I'm Abby. I'm going to be your physical therapist today. Can I get your name?
Yeah, it's Abby Laughlin.
All right. Is it all right if I work with you today?
Yeah.
Okay. First thing I'm going to have you do is lay on your back for me. Thank you. And the first thing I'm going to find is the ASIS. Oh, sorry about that.
You're fine.
First thing I'm going to find is the ASIS. So I'm going to find your iliac crest up here. And this bony prominence right here, that's just anterior off that iliac crest, it's your ASIS. And then from there, I'm going to find your femoral pulse. So if I could have you make like a figure 4 here. There you go. Thank you. And I'm just going to go in this femoral triangle region and slowly palpate towards that pubic bone. And I'm going to find that femoral pulse right there. Perfect. And then next, if you'll straighten out your leg again, I'm going to find the belly of your rectus femoris, which runs from your ASIS down to this patella right here. So I know that the belly runs right here. And if you could just lift up your leg for me, I can feel that muscle contract there. Thank you. And next I'm going to find the medial joint line of the knee. So the knee joint right here, and there's the medial line and the lateral line. So if I palpate right there, I'm on the medial joint line. Next I'm going to find the inferior pole of that patella. So we have the base up here, the apex down here. So this inferior pole of the patella would be right there. Next I'm going to have you go into a sideline position. Thank you. And the first thing I'm going to find is the gluteus medius, which I know is right up here in the superior gluteal region under the iliac crest. And I can place my hand where I think it would be. And if you could lift up your leg for me, and I can feel that contract right there underneath my fingers. Thank you. Next, I'm going to find the middle portion of the IT band. So the IT band runs all the way up here from the iliac crest down to the knee region. So if I palpate down here, then I'll be in the middle region of that. And once again, if you raise your leg up for me, I can feel that band tighten right there. Thank you. Next, if you could lay on your stomach for me. Thank you. All right, so the first thing I'm going to find is the greater trochanter of the femur. So I know that that is on the femur bone down here, so it's distal to these superior gluteal muscles. And if I palpate down, I'll feel a large bony landmark right there, and that is the greater trochanter. Next, I'm going to find the belly of the semitendinosus, which is one of the hamstring muscles, and I know it's on the medial side, but it's not the most medial. So if I have her flex her knee for me, I can feel this tendon right here contract, and that is the tendon of the semitendinosus. And then if I work my way proximally, then I'm on the belly of that muscle there. Next, I'm going to find the lateral head of the gastrocnemius. So I know that there are 2 heads, and they insert on the lateral and the medial condyles of the femur. And so that lateral head is right here on the lateral condyle of the femur. And then I'm going to have you in a seated position with your legs off the table here. And the first thing I'm going to find is the fibular head. So I am going to lift your leg off the table here, and I'm going to palpate distally from the femur past that knee joint until I find that lateral bone, and the head right there is the head of the fibula. Next, I'm going to find the belly of the fibularis longus. So that actually originates here off that head and runs to the plantar aspect of the foot. And if I have you evert, I can feel that muscle belly contract there as it wraps around the foot. Next, I'm going to find the medial malleolus, which is just the distal aspect of the tibia here. And then you can feel that right there on the inside of the ankle. Next, I have the anterior talofibular ligament. So for that one, I need to find the talus and the fibula down here in this ankle region. And that ligament would just be a small ligament right there in the anterior lateral ankle. Next, I'm going to find the navicular tubercle. So the navicular bone is right here. And if I palpate around in this medial aspect of the foot, I can find that bony prominence right there, the tubercle. And next I'm going to find the base of the second metatarsal. So my metatarsals are right here. So if I start on the first one, I can kind of work over onto that second one. and the base is just right here distal to those cuneiform bones. And from there, I'm going to find the head of the third metatarsal. So moving off of the second one, I can move to the third, and the head is going to be distal here right before those phalanges. And finally, the medial calcaneal tubercle. If I look at the calcaneus back here, we have the lateral and then the medial aspects of that, and that medial calcaneal tubercle is just down here on the medial aspect.